In the United States, at the epicenter of the global pandemic, you hear strong messages about clear sailing ahead. The virus is disappearing.
If you look, the numbers are very minuscule compared to what it was. It's dying out.
In recent days, the president's economic advisor, Larry Kudlow, has been categorical. There will be no second wave.
I spoke to our health experts at some length last evening. They are saying there is no second spike. Let me repeat that. There is no second spike.
That's not what you hear about a second wave from one of the world's foremost experts on infectious disease.
I think it's probably a statistical certainty, barring any unforeseen events.
Gabriel Leung grew up in Toronto and studied medicine at Western University. Then he obtained postgraduate degrees from Harvard and Hong Kong University and is now Dean of the Medical School in Hong Kong. He was among the first to warn about a global pandemic in the Lancet Medical Journal back in January, and now he is warning about multiple waves to come.
I think that we are adapting to a new normal until a safe and effective vaccine becomes widely accessible to the majority of the world's population. And I'm afraid until that happens, we are going to be looking at perhaps more than a couple of waves of this pandemic sweeping through our respective populations.
The nightmare model of what a second wave could look like is the 1918 flu pandemic. It was called the Spanish flu, even though it originated in the United States. The first known cases were in Kansas in the spring of 1918. Then it was transported across the United States and to Europe by U.S. troops fighting the First World War. In the fall, the second wave came back to North America aboard troop ships in a much more virulent form. Suddenly, patients could start bleeding profusely from the nose and ears, or just keel over and die in a matter of minutes. Philadelphia was among the hardest hit after a Victory Bond parade in September that brought thousands to congregate in the streets, spreading the virus. In the end, the virus killed an estimated 500,000 Americans, 50,000 Canadians, and millions more around the world.
The 1918 H1 influenza outbreak, really in many populations, the second wave was by far worse than the first. And I think that, I fear, might happen again. Of course, we have no way of knowing beforehand, but I do think that it would be prudent and responsible of governments and public health authorities to prepare for such a possibility.
Leung sees an echo of that famous Philadelphia parade in the massive crowds we're seeing around the world. From the anti-racism demonstrations in the United States and Europe to the pro-democracy protests in Hong Kong.
I'm worried about any kind of mass gatherings, whether it's in my own town or whether it's halfway around the world, in your southern neighbor or in Europe. Whether it's rock concerts or whether it's protests, marches, I think that we need to be very, very careful.
As for the prescription of how to go forward from here, Dr. Leung is categorical about a few issues. One is the wearing of masks.
Masks are absolutely necessary, but they're insufficient. So I think that the scientific evidence, it's almost becoming indisputable now. Wearing a mask is really a sign of respect that you have for people you come in contact with. The main beneficiary, in fact, of you wearing a mask is not yourself, it's people around you.
When it comes to testing, Dr. Leung says we should be doing far more than we are doing now, and that almost every private company should be testing its own employees.
And so I think testing needs to be ramped up way beyond what the public sector capacity could possibly meet. And that's why we need to enable and empower and finance public testing. You need to also encourage, incentivize, and facilitate private sector contribution and participation.
He sees widespread testing as the key to resuming air travel.
Quarantining for any extended period, like 14 days, is a huge damper on cross-border travel. And I think that, look, it's almost a no-brainer. If you can, then ramp up testing so that you could actually then lift, if not entirely, at least some of that quarantine burden.
One element that Dr. Leung is optimistic about is vaccine development, because he says it does not have to be administered to everyone in the world to prevent them from getting the disease.
Imagine that we get a vaccine that perhaps can take away most of the serious complications. It would prevent people, even if they get infected, from needing to be intubated, from needing ICU care, from dying. That would be a major advance already.
Gabriel Leung was among the first experts to rush to Wuhan at the beginning of this outbreak to assess the threat on behalf of the World Health Organization. He agrees that the role of the WHO must be re-examined, but now is not the time.
We're in a marathon. We're not in a sprint. And I don't think that it would be helpful to try and look back while you are still in the first half of your marathon, or maybe even not the first half yet. So I don't know of any marathon runner who keeps looking back while they're still running. So I think that accountability and also transparency and retrospective review to learn lessons is important. But we do that after the marathon has been run and won, hopefully, not during the marathon itself.
When the summer ends and the cold weather returns, will there be a second wave? Gabriel Leung says the only safe course is to presume that there will, and perhaps not just one. Terence McKenna, CBC News, Toronto.